This is Daily Dose of Medicine. This video will be talking about celiac disease. It's an autoimmune disorder triggered by ingestion of gluten in genetically predisposed individuals. It leads to change in small intestine, specifically the villi, which impairs the nutrition absorption. The clinical presentation is variable. While some patients exhibit classic gastrointestinal symptoms like diarrhea, weight loss, and abdominal pain, others may present with extraintestinal manifestations like anemia, osteoporosis, dermatitis, herpetiformis, which is skin manifestation leading to blisters, and neurological symptoms like peripheral neuropathy and ataxia. And chronic malabsorption, disruption of the absorption, characterized by greasy, large volume diarrhea and weight loss. Because with celiac disease, we have chronic malabsorption. We usually see large volume full smelling stools, excessive flatulence, and weight loss with microcystic anemia. In many patients, the only presenting feature could be iron deficiency anemia. Additionally, some individuals may be asymptomatic or have subclinical disease, which can make it harder to diagnose the celiac disease. The pathogenesis involves complex interplay between genetic and environmental factors. The ingestion of gluten in genetically predisposed individuals, those with HLA-DQ2, HLA-DQ8 haplotypes, triggers an immune response that leads to small intestinal damage. This immune response is characterized by the production of antibodies against tissue transglutaminase and endomysial antibodies, as well as the activation of gluten-specific T cells, which cause villous atrophy and crypt hyperplasia in small intestine. And we use those to diagnose. For diagnosis, we use those antibodies I told you. And if these tests are positive, we do the EGD with duodenal biopsy. And we confirm the diagnosis by demonstrating histological changes I told you. Villous atrophy, which you can see on this picture, with crypt hyperplasia. Crypts are small glands at the base of the villi. In crypt hyperplasia, these glands become enlarged and overcrowded. And intraepithelial lymphocytosis, this refers to increased number of white blood cells within the lining of the intestine. This often is a sign of the inflammation and can damage the intestinal tissue. For treatment, the mainstay is gluten-free diet. Dietary counseling, therefore, an important part of the overall management. Those who are diagnosed with celiac disease should be referred to a dietitian to tailor a diet their specific needs. The principal source of gluten in the diet is wheat, rye, and barley, and consequently all patients with celiac disease should be advised to refrain from eating foods containing these products. In addition, patients should be informed that the consumption of soybeans, rice, corn, and potatoes is safe. Most patients will show some clinical improvement approximately 2 to 3 weeks after the initiation of the gluten-free diet. However, normalization of the villi can take a few months. For patients who do not achieve symptomatic improvement, a detailed dietary history should be obtained, since the most common reason for lack of response is poor diet adherence. In patients who are adherent and continue to have symptoms, further evaluation for comorbidities or alternative diagnosis like lactose intolerance should be performed. In addition, for prevention of complications, because we're eliminating gluten from the diet, patients should also have levels of iron, folate, calcium, and other vitamins like A, D, E, B12 monitored. Similarly, they should have a DEXA scan to evaluate for bone loss due to common vitamin D deficiency, and receive the pneumococcal vaccine due to associated hyposplenism. Thank you so much for watching. Don't forget to watch the videos I'll be putting in the screen. Don't forget to join our channel membership, which helps a lot. And I'll see you on the next one.